G'day team, I'm Dr. Sean Price and I'm trying to save the world with a seat for humanity. Let's talk about antibiotic resistance. A few years ago, a woman from Nevada was admitted to hospital with an infection that doctors thought that they could treat, but tests showed something terrifying. The bacteria in her system was resistant to all 26 antibiotics available in the US. She had broken her leg in India during a holiday trip, but it got infected. When she returned home, no medicine left on earth could stop it, and she died from a completely untreatable infection. If antibiotic resistance continues to get worse, then we could go back to a time where a simple cut or scrape could kill you. But hold on one second. Let's do a quick 101 on immunology. When you leave food outside, it starts to rot. Why? It's because microbes start eating it. So how come we don't rot? We're full of yummy nutrients for microbes too. What's stopping those microbes from doing the same thing to us? Well, that would be our immune system. It's like this 24/7 security team inside your body, constantly spotting, attacking, and destroying microbes that want to invade you and use your nutrients for themselves. And a couple hundred years ago, if you got an infection that your immune system couldn't fight off, that was basically it. A small cut, a bad cough, a simple bacterial infection would kill people. Then scientists developed antibiotics. Suddenly, if your immune system couldn't handle an infection, we had a backup. These powerful medicines could kill the bacteria for you. But here's the twist. Every time we use antibiotics, they kill most of the bacteria, but sometimes not all of them. A few survive because they happen to have a tiny natural mutation to adapt to a different environment. And those survivors multiply over time. We're using antibiotics way too much in society. People are prescribed it too quickly. It's used in the factory farming of animals to prevent them from getting sick in their horrible living conditions. And it's even leaking into the environment from our sewage. This is giving bacteria lots of chances to adapt and evolve to become antibiotic resistance. If this gets out of control, then routine surgeries, common infections, even childbirth could become far riskier if antimicrobial resistance continues unchecked. And according to the WHO's 2025 AMR surveillance report, over 5 million deaths each year are now associated with drug-resistant infections. There are some efforts to combat this, including new drug development specific to AMR infections, experimental antibiotics, and regulations limiting antibiotic use in livestock. But World Health Organization data shows that global efforts are still falling short, especially in poorer countries that lack monitoring systems. We lack the ability to globally coordinate and control the spread of antimicrobial resistance. Antimicrobial resistance isn't just a medical problem, it's a global one. Bacteria doesn't care about borders, and even if one country does everything right to reduce antibiotic misuse, it means nothing if a superbug emerges overseas and spreads across the world, as infections always do. A seat for humanity is a seat focused on global issues like antimicrobial resistance. It puts global health security on the political agenda, with a dedicated voice within the Senate, pushing for stronger antibiotic stewardship and real antimicrobial resistance monitoring, and international cooperation, because no country can solve this alone.